a slightly different insole now in the range, and that is the Bio Skive. Now this one has an inbuilt 4mm heel skive into it. Now normally you would use, or heel skive would be used on a casted device, and it's a modification that you would do to a cast for prescription orthosis, but as I say, the Bio Skive does have that built in, so it's an off-the-shelf device which has a medial heel skive built in already. Now usually these are designed specifically, or you would use a medial heel skive for patients who have a medially deviated axis. Now if you want to know more about that and how to find a medially deviated axis and how to measure it and so on and so forth, have a look on the LBG medical website, look under education and look at webinars, and there's a full 45-minute webinar which tells you all about that. Essentially though, if you've got patients with a medially deviated axis, it means that you've only got a very small amount of area to work on to try and correct the position of that foot if you need to. So if we were going to post this device, we've literally only got the side which is medial to where their axis lies, and that's why we have a build up on the skive area here. Now there's two different types in the, well, the same, but two different densities. So we've got a low density and a medium density. So for more aggressive control, you'd want to use the higher density because it's got less give. If you've got on well with it, or your patient's got on well with it, you can add more posting underneath. You can heat mold it. Another little tip you can use, just with some things you might have in your clinic every day, a little bit of moleskin, again sharp pair of scissors, and you can actually build up that skive even more. So it's already got a 4mm skive, but we can stick extra bits on there and we can build it up. You could also use thin adhesive pour-on, you could use semi-compressed felt, but if you just want to do a little bit at a time, moleskin works really well for that, and then you can strip off layers or add layers accordingly. Now it doesn't necessarily have to be a patient with a medially deviated axis, it could just be a patient who needs more aggressive control. So you might want to put lots and lots of posting underneath, you might want to heat mold the arch up, and then you've also got the extra control on there with the medial heel skive. So as I say, very specific, very good, this device for someone who needs a lot of biomechanical control. Both of them are full length, but you can trim them down with a sharp pair of scissors and make them 3/4 length. And you've also got the plugs on there as well if you've got a patient who needs more flexibility in the first met. So very easy to trim, and also very easy to do extra additions such as first ray cutouts if you want to make the device more bespoke to that patient. But key feature on there, inbuilt 4mm medial heel skive.